Very good morning to one and all. Today we are going to learn about management of gingival tissues. At the end of the class, you will be getting to know what is the definition, what is the triad for successful treatment, and why it is required for maintaining the principles of aesthetics, and what are the different treatment options for management of gingival tissue. So all those domains that will be covered in this topic are cognitive and must know for every dental professional. So it is a very important step, and as we all know that the teeth and periodontal tissues are very closely related. Hence, management of gingival tissue is an important aspect in restorative dentistry. So basically, it is a procedure of widening of gingival sulcus to expose the cervical portion of the tooth and deepening of gingival sulcus to expose the cervical portion of the tooth so as to have proper finish of the restorations. Indications: it is mostly indicated in subgingival extensions of the margins due to subgingival decay or fractures, where there is need to control the gingival clavicular fluid, or wherever there are chances of gingival hemorrhage. So in such cases, we need to manage gingival tissue, where we have to place restorative crowns, aesthetic crowns. In that areas, we have to manage gingival tissues, particularly recording of the preparation of the margins of the tooth during impressions in impression making. Wherever there is a gingival overgrowth, or we call as a polyp, we need to remove it. And whenever there is a compromised available crown ratio, to improve the retention, we are doing gingival tissue management to enhance the crown root ratio for success of good restoration. The only contraindication whenever there is a poor oral hygiene and presence of gingival tissues. So there are different techniques of management of gingival tissue management. First, physiomechanical method, then chemical methods, rotary curettage, surgical method, and electrosurgical method. In physico-mechanical, it is the principle of displacing the gingival tissues outwards and apically away from the tooth. And for this, we are having rubber dam with the use of cervical clamp number 212. We are having several wooden wedges to displace the gingival tissue. Rolled or cotton quills are there, and in retraction cord, which may be braided or unbraided, ranging from size 0 to size 3. So these are the methods for physiomechanical methods. Here you can see the same things, the gingival retraction tissue cord that is placed into the gingival sulcus before taking the impression. So this will control the fluid, gingival clavicular fluid, and the hemorrhage. Now in chemico-mechanical methods, it provides safe, predictable means, and we are using vasoconstrictors like adrenaline, noradrenaline, which act by local vasoconstriction. It is usually contraindicated in patients having cardiovascular diseases, hypertension, and diabetes mellitus. Other way of using is astringents, which usually comprises of alum 100%, aluminum chloride 15 to 25%, ferric sulfate 15.5%, and tannic acid 15 to 25%. These are very safe methods for chemomechanical methods. Then we are having various tissue coagulants like zinc chloride and silver nitrate. They act by coagulating the surface layer if sulcular and gingival epithelium along with the fluids, but usually cause ulceration, necrosis, and changes in contour. And hence, for this purpose, nowadays silver nitrate has been contraindicated as a tissue coagulant. We are having several chemicals like sulfuric acid, trichloroacetic acid, negatol. Negatol is a combination of 45% metacresol, sulfonic acid, and formaldehyde. Out of this, TCA is very commonly employed for as a chemical, solely chemical for managing the gingival tissues. But again, it has to be used very cautiously and its use has to be limited to particular operating site only. Next technique is rotary curettage and also known as gingitage. In this, troughing is done by chamfer burr. It removes excess gingiva but causes excessive bleeding, and that has to be controlled by use of chemicals which we have already discussed. In the last method, we have surgical methods which uses sharp knife and conventional periodontal surgery to remove hypertrophic gingiva. And following surgery, it requires placement of temporary restorations to allow proper healing of the gingiva. Another technique is electrosurgical method, and it is used when access to surgical area is not possible by conservative means. It is mostly useful in removal of hypertrophic gingiva not responding to conservative treatment. It is rapid, atraumatic cutting of soft tissues. It sterilizes the wound immediately, and it provides dry field free from hemorrhage. The most advantage of this technique is healing occurs by primary intention without leaving a scar or without having swelling as a post-surgical complication. Now, what are the principles of electrosurgery? It uses alternating current at high frequency concentrated at tiny electrodes to perform its action. Like the first is the cutting. It is done precisely using minimal energy and does not induce bleeding. Second is coagulation, where it uses greater energy and there is surface coagulation of tissues, gingival fluid, and blood. In fulguration, a lot of heat is generated and there is deeper tissue involvement associated with carbonization. And in last, it is desiccation. It includes massive tissue destruction and is uncontrolled. So for electrosurgery, we should have proper isolation. Use of fully rectified current with minimal energy output is required for safe surgical outcome. Use of probe or loop type of electrodes with light, rapid, and intermittent strokes is important. And for coagulation, use bulky unipolar electrodes. Avoid contact of electrodes with metallic restorations and clean the electrode with alcohol sponge after use. In recent advances, we have lasers and retraction by dilation of gingival sulcus. So in lasers, we are having soft tissue lasers, and most commonly that is being used is Nd:YAG lasers. In this, gingival tissue is retracted and excised. It works through principle of photoablation and produces bloodless incision, controlled tissue removal, and pain-free healing. It is a slow and expensive techniques at there is a recurring cost for the laser tips. Whereas the other method, that is retraction by dilation of gingival sulcus, we have various commercial products which causes dilation of gingival sulcus. Out there, gingiform technique has used, which uses modified silicone elastomer as a base and catalyst paste. The base paste containing polydimethyl siloxane and the catalyst paste contains tin. On combination, the reaction produces hydrogen gas within the silicone matrix, resulting in formation of foam. On similar principle, we have a commercial product available, that is Expasil, and this release of hydrogen gases causes retraction, dilation of the gingival sulcus, thus leading better recording of impression paste. So this technique employs a paste of aluminum chloride, kaolin and water delivered by a gun into the sulcus, and it is comparatively an easy and efficient method as compared to that of use of lasers. So to conclude, management of gingival tissue is very important considering the long-term clinical success of restorative treatment. Sound periodontal condition enhances longevity and aesthetics of the treatment. Hence, the dentist should be well versed in all procedures and appropriate method for the given situation, and apt use of the procedure is very important for the success of restoration. So it is very important topic in terms of clinical management of patients as well as theory part. A short note and long question can be a question. Thank you.